Signs and symptoms of a dislocated joint or fractured extremity include the following: exposed bone ends, joints locked in position, deformity, pain, paralysis, paresthesia, a prickly or tingly feeling that indicates a loss of sensation, or pallor, a pale skin color at the injury site. Splinting the extremity immobilizes the limb and prevents further damage to soft tissue, nerves, blood vessels, and the bones themselves. Effective splints always immobilize the adjacent joints and bone ends. Many types of commercial splinting devices exist that are usually categorized as rigid, such as a cardboard splint, formable, such as ladder or vacuum splints, and traction, such as hair or Sager splints. Traction splints are used specifically for femur fractures and will be addressed separately. Only stable patients with minor or isolated injuries should have individual extremities splinted on scene. Any unstable patient or a patient with life-threatening injuries should have his or her entire body immobilized on a long spine board and transported without delay. Take BSI precautions. Explain the splinting procedure to your patient, gaining his or her consent to perform the procedure. Any kind of manipulation of the extremity may be painful. Prepare your patient for the temporary discomfort, assuring him or her that immobilization will minimize pain thereafter, as well as prevent further injury. If possible, expose the area to be splinted. Utilize a second rescuer to hold manual stabilization of the bones above and below the injury site. Assess the patient's distal pulses, motor function, and sensation, or PMS, in the extremity prior to immobilization. A lack of distal circulation is an indication that you should attempt to realign the extremity. Realign the injury if deformed or if the distal extremity is cyanotic or pulseless. Continue until you achieve neutral alignment or the return of circulation. If you feel resistance, stop realignment and splint the deformed injury in place. Measure the splint to several inches beyond both joints, above and below the injury site. Measure the device on the opposite extremity if possible to avoid bumping and/or further injury to the extremity. With the second rescuer maintaining stabilization of the extremity, position the splint on or under the extremity. Pad the splint where necessary. Rigid splints need padding to avoid pressure points within the splint. Other splints may need padding in areas of void. Gauze, pads, towels, or other soft items can be used as padding. Secure the splint in place with cravats, cling, tape, or other fasteners. The device should be secure enough to prevent movement, but not constrict distal circulation. If using a vacuum or air splint, secure the splint, then adjust the air pressure. You may need to slightly adjust the straps once the pressure is adjusted. Recheck distal PMS now and periodically throughout the treatment and transport to ensure the splint was not applied too tightly or that swelling of the extremity is not creating a new situation where the splint is now too tight. If the splint is applied too tightly, loosen it immediately and reassess distal PMS.